Welcome back, everybody. If you've got questions here on Ask the Expert, give us a call at 613-789-6559, extension 2803. We're at the Ottawa Physio and Sport Clinic. I would guess that a lot of people in this city are using a physiotherapy outfit today and over the next little while because of Ottawa race weekend. We noticed, Matthew, that Jeff Hopper had been limping around a little bit today, and he's got a little hip problem. He's got a little thing going on one side of his body. He ran a half marathon yesterday. So you look at that sort of thing, and there are various things that can happen, right? Various degrees of soreness or small injuries that can occur when you're running like this.
Yeah, for running, basically, like I said, so you're running a lot, your legs doing the same thing for a very long time, and you're going to irritate either tendons, muscles will get overused, swelling is going to happen. You might even injure some ligaments depending on how your leg is moving. So any one or combination of that is fair game for anything in the lower leg.
Right. Do you tend to see a lot more people come through your doors or give you calls after an event like this?
To be honest with you, we get a lot of them before race.
Yeah.
Okay, that's normal. And then after race, everyone's basically too sore to go to anywhere. They're probably at home icing in a big bath of water kind of deal. But we will start seeing them maybe after Wednesday, we'll say.
Right. So they're taking a couple of days to try and get through this.
Yes.
And then if it persists, that's when you call a physiotherapist or a doctor or what have you. Is that a good idea then? Let's say you have incurred some sort of injury that you know nothing about.
Yeah.
What's the first step? Do you go to a doctor first?
You could go either one, depending on the severity of the injury. Like if there's a lot of bruising, for example, then I would recommend seeing a physician. If it's just a stiff joint or it's really sore, maybe even swollen, yeah, you could go either way, a physician or a physio. Right.
And then if the problem persists, you've obviously suffered some kind of injury, so then you should have it looked at by one or the other or both.
Exactly. And if it is a significant injury, when you see the physio, we'll be able to tell you, you know what, this needs a higher level of care, and we can send you on to the appropriate level.
Right. I would guess that the major amount of so-called injuries after a run like a half marathon or so on would just involve soreness, but there are other factors that could enter into the picture, and you could have injured a knee, you could have injured an ankle, you could have done something along the way that might require some sort of treatment.
Right, and everybody has a muscle imbalance. Having a muscle imbalance isn't a big deal, but if you have a muscle imbalance that perpetuates for 42 kilometers, then it might be a bit of an issue by the time you're done the race.
Right. And the other thing is, whether it's a half marathon, 10K or whatever, you might have injured yourself early on, and then you're running on top of that because you want to finish your event, whatever that might be, and you're compounding the injury along the way. So that's something to consider as well. One
of the biggest things that we deal with is because race weekend is so early in the year, a lot of the training people do is indoors. And with the rain and everything we've had the last couple of weeks, so a lot of people don't spend as much time outdoors as they should for a race weekend.
Right.
So training on a treadmill, though, is nice. It's not the same as running on the road, and that usually they realize that probably by Wednesday.
Isn't it true that the atmosphere itself, like running indoors, and then even if it was on the same sort of surface as a treadmill, outdoors is just completely different?
Completely different, and a treadmill also helps you run, right?
Yeah.
So the surface is different, so the machine's helping you run. On a road, you're going up and down on hills. So there's variables there. Plus, on a race weekend, you're nervous. You might run a little bit faster. You might run a little bit slower.
Right.
You might be trying to avoid somebody.
Right.
So there's all sorts of things that get in the way.
It's funny you should say that, because one of the people we were watching and watching run yesterday, and many talked about this after, is the crowds when there's 12,000 people in the middle of a half marathon and another 7,200 doing a full marathon, and they all come together at one point. It was difficult to avoid people on the race course, and you're right, there could be you could run into someone, turn an ankle, whatever, and the next thing you know, you're down and out.
Right.
So.
Well, when I did the 5K on Saturday, I ran with a patient because she had never done a 5K before.
Right.
So I was running at a slower pace with her, and she got through the race. She wanted to stop a couple of times, but I sort of poked her a little bit. She's going to be a little bit sore today, muscle-wise, but she should be okay. And Peter, for example, he ran a 10K for the first time.
Right.
Didn't train at all, so that's not a good idea.
No.
But still running a 10K, for the first time, he ran a 53-minute 10K.
That's pretty good.
So that's not so bad. But Pete's going to be a little bit sore, if not now, probably by tomorrow.
Right. We do have a couple of questions to deal with. We'll get to those in our next segment, but it does give you the opportunity to ask a question of Matthew here today. especially if you were involved in race weekend in one way, shape, or form. 613-789-6559, extension 2803, ottawa.morning@ctv.ca. Facebook questions are welcome as well. We'll be back with more of Ask the Expert and Ottawa Physio and Sport Clinic right after this.